Good day everyone, and I am Professor Shahid Hassan, and you are watching examination of the lymph nodes in the neck as the microlearning content, which is one of the series of microlearning contents developed to complement your digital learning as part of the ENT examination. The whole video will take not more than 10 minutes. The learning outcome for this microlearning content is to demonstrate the examination of a patient using Robin's lymph nodes clinical levels of classification in ENT setting. Now let's consider how the lymph nodes are classified in the neck before we consider how they are examined. So the lymph nodes are classified two ways in the neck. First is the lymph nodes regional classification, and the other is the lymph nodes clinical level classification proposed by Robbins. So the lymph nodes regional classification include the facial group as superficial, cervical, and the buccinatal lymph nodes. Number 2, submental and submandibular lymph nodes. Number 3, jugular group of lymph nodes. Number 3, supraclavicular lymph nodes. And number 5, parotid group of lymph node as periparotid, preauricular, and intraparotid lymph nodes. Number 6, mastoid group as the retroauricular and the postauricular lymph nodes. Then number 7, occipital as superficial and deep lymph nodes, and number 8 as the retropharyngeal as medial lymph nodes and the lateral lymph nodes. And this also includes the node of the rovea, the most superior of the lateral group of lymph nodes. Now let's see the lymph nodes clinical level classification proposed by Robbins, and according to this classification, the lymph nodes in the neck are classified as level 1A as the submental group of lymph nodes, level 1B as the submandibular group of the lymph nodes, level 2 as the upper deep cervical chain, level 3 is as the middle deep cervical chain, level 4 is as lower deep cervical chain. Level 5 as posterior triangle or the spinal accessory group of lymph nodes, and level 6 is as the prelaryngeal, pretracheal, paratracheal, delphian lymph nodes and the lymph nodes in the thyroid capsule and the isthmus, and this is the longest chain, also known as the central group of lymph node or the anterior group of lymph nodes. Level 7 is the anterior mediastinal group of lymph nodes. All the lymph nodes in the neck classified this way are palpated except the 7, which is behind the bony structure, sternum, so it has to be percussed. Beside these 7 levels, the shortcoming of this level classification is that 3 group of lymph nodes are not included in it, and those are separately examined, are the preauricular, postauricular, and the occipital group of lymph nodes. Now it's time to watch the procedure how to examine lymph nodes clinically with regards to its level of classification. Hello, I'm Dr. Shahid. I'm going to examine you for your complaint of the swelling in the neck, right? I have to do the examination of the lymph node. So primarily the lymph node would be examined for 7 levels. So in a systemic way order that I would start, and I'll prefer doing it. One can do it, start from anywhere, but it's good to start with a systemic way from level 1 to level 7, and then the other 3 regions which is not included in the nomenclature of the lymph node classification in the neck. So the level 1 as we start is the submental, right? So we start with the flat of our finger, not with the tip, because tip will give some artifact. So flat of the finger, right? So I start with submental. Can you have neck slightly flex? Oh, good. Okay, so submental, then submandibular, level 1A, level 1B, right? Then we go to level 2, which is here, right? Then level 3, slightly down. Then level 4, supraclavicular, right? And then we have the posterior triangle, level 5, okay? And for the level 6, which is in the midline, central group of lymph node or the the central group of lymph node. So, or the anterior group of lymph node is the other name. So, level 6 below the submental, anything in the midline which is pretracheal, prelaryngeal, pretracheal, tracheoesophageal groove, and the lymph node in the thyroid gland and the isthmus. Okay. For the so this completes, except the one which is there, we have to percuss level 7, right? Level 7 has to be percussed because it is in the anterior mediastinum. So the sternum falls in front. So these are the 7 levels, but to demarcate 7 levels, how do you really divide them? So this is the chin, this is the, if I take a probe here and demonstrate with the help of a probe there, right? So this is the, can you turn the margin of the mandible? So the first line, arbitrary line drawn, is from the margin of the mandible. Then you feel the hyoid bone, right? This is a bone, hyoid bone. So the second level line will be arbitrary line from the hyoid bone. The third is you go down and until you feel the cricoid, and the lower border of the cricoid is your third arbitrary line, and the fourth arbitrary line is your anterior or the superior border of the clavicle. So this will divide your lymph node into 7, basically 4. The 5th is in the posterior triangle, right? So I may go and repeat again, and three group of lymph node which is not covered in the level are 3, which is pre-auricular, which we have to do exclusively apart from the 7 levels, pre-auricular, post-auricular, and the occipital group of the lymph node. Okay, so once again I will repeat that after having understood the 7 levels, how these are actually determined, with the arbitrary line dividing it into 4 level, then 5th is in the posterior triangle, and for posterior triangle we have to understand what is posterior triangle. We have a midline. This is a midline, right? So this is the midline, and then this is the sternocleidomastoid. The sternocleidomastoid muscle and the midline forms the anterior triangle with the base of the mandible. On the other hand, the posterior border of the sternocleidomastoid muscle and the trapezius going this way and the clavicle below there form the base is your posterior triangle, right? So the swelling usually is actually classified into midline swelling, right? Anterior triangle swelling and the posterior triangle swelling, right? So, or the midline and the lateral swelling also in other words, okay? So this is how would you examine the lymph node in the neck, okay?
Now let's do the self-assessment with 3 quizzes, one each as SAQ, true, false, and MCQ with more than one answer.
Now let's have a quick self-assessment with one SAQ, one true, false, and one MCQ. Question number 1, which is SAQ, is classifying lymph nodes into 7 levels, have further subgroup as A and B. Identify the lymph node levels which are further classified into A and B. Supply the correct answer which can be more than one level. Question number 2, which is a true false. It is the level of 6 lymph nodes in the tracheoesophageal groove that extend from the suprasternal notch to the innominate artery. You have to identify it as either true or false. Question number 3 is MCQ with more than one correct answer. Select correct answer which can be more than one for characteristic feature of the malignant lymph nodes. A, more than 5 mm in shorter axis. B, oval in shape. And C, loss of echogenic center.
Thank you, and watch your performance with your own self-assessment, giving marks, 1 mark for each correct answer as in this rubric.
And here are the correct answers for question number 1, 2, and 3. Let's quickly summarize the microlearning content. Lymph nodes in the level systems are divided into 7 levels by 4 arbitrary lines, including level 1, submental and submandibular, level 2, level 3, and level 4. Level 5 is in the posterior triangle of the neck. Level 6 is the central or the anterior group below the submental to supraesternal notch. In examining the neck for lymph nodes palpation, a systemic approach is best followed from level 1 to level 6. Level 7 in the anterior mediastinum is percussed for any retroesternal lymph nodes implication because it cannot be palpated.